Hello and welcome everyone to the Sonoma County CareerFest Health Science Panel. I'm Nicole Kinsella, the College and Career Counselor at Pioneer High School and the moderator of today's session. So Kim Handel, the College and Career Counselor from Maria Correa High School, will be monitoring the Q&A. And we also have Brandon Jewell here from the CT Foundation on tech support. So I want to thank them and all of you, the panelists and the attendees, for being here today. And before we get started with our speakers, I want to let you know that the chat has been disabled, but I want to encourage you to use the Q&A to ask questions of any of the panelists. So I'm excited to bring to you today Beth Blanchard, physical therapist at Kaiser Permanente. We also have Mary Kay Brooks, risk director at Kaiser Permanente. We have Bree Foster, nurse at Memorial Hospital, and Mackenzie Galindo, career education counselor at the Santa Rosa Junior College. So welcome everybody. And Mary Kay, if you could go ahead and get us started by briefly introducing yourself and give us a short overview of what you do as risk director at Kaiser. And you can also include the educational path you took to get to where you are.
Great, thank you. Pleasure to meet everybody and hopefully get some great questions from the group. So my name is Mary Kay Brooks. I am originally from Iowa and I've been out here in California since 2016. My current role as the risk director for Kaiser for Santa Rosa and San Rafael is that I work with clinicians and other staff members around both hospitals to keep our patients safe. So such as preventing infections, medication errors. We look at like clinical practice guidelines, make sure we're adhering to all of the standards. And, just really keeping a focus on, what is the most important part about patient care, which is providing the care they need to get better and get out of the hospital, and then keeping it as safe as possible. So my career path is I started as a staff nurse way back in 1992. I worked on the burn trauma unit in Iowa, actually. And then at that time, we didn't have an electronic medical record, and I really liked computers. And so when we started getting ready to implement the electronic medical record, they needed a volunteer. And so I volunteered to be the person to help get that rolled out on our unit. And then through that work with computers, I ended up going down the nursing informatics route, which is using nursing language with computers and science. And then that sort of work goes well with the quality department because you're looking at a lot of outcomes data on patients like infection rates, fall rates, medication error rates, things like that. And so then I've been doing quality since 2001 and then just kind of moved up through the ladder to be a director doing that work. So that's me.
Awesome. Thank you so much. All right, Bree, if you could give us a short overview of your work as a nurse at Memorial Hospital, your role and your educational path.
So my name is Bree Foster. I grew up here in Santa Rosa. I went to the Santa Rosa High School. And then after going there, I decided to attend classes at the SRJC. While attending classes there, I kind of worked different little odd jobs and eventually decided to actually get my phlebotomy certification, which I did through the Santa Rosa JC as well. And then I took a couple of years off and just worked in the lab at Palm Drive Hospital, and really kind of being exposed to medicine and the hospital environment and clinical lab science, I decided to go back and start doing my health sciences classes, again at the Santa Rosa JC. And then in 2015, I graduated from the ADN program there and went to the Sonoma State University Nursing Transition to Practice program and got placed at Santa Rosa Memorial Hospital, and then was hired on after about 2 months in the summer of 2015. And then I pretty much started my career there on the cardiac telemetry unit and worked there for 5 years. And then for the last year and a half, I've been in the gastrointestinal services department doing endoscopy. So I get to meet different patients every day, and they come in for their GI procedures, and I work in that department, and that's what I'm doing now.
Great, thank you. And Beth, if you could briefly introduce yourself and give a short overview of your work as a physical therapist at Kaiser and your career path.
Yes, thank you for having me. I'm happy to be here. So I work at Kaiser Permanente in Santa Rosa. I'm in outpatient rehab, so not in the big main hospital, but in one of the medical office building clinics. And there in rehab, we see a variety of patients. I tend to see an average of 10 to 13 people a day, and it could range from anything, from sports medicine to orthopedics, like people that have broken bones or sprained things or had surgery. We see patients that have had neurological stuff like strokes and amputations and Parkinson's, and so a wide variety of patients that we treat. And so I was born and raised in Sebastopol, and I went to Annalee High. And after Annalee, I got my bachelor's degree at Chico State, and that was in exercise science. And then I went to Samuel Merritt College, which is in Oakland, and I got my master's there in physical therapy. And I've worked, when I was trying to get into PT school, I worked at UCSF just to get some hours for school. And then my internship for school in my last year, I was lucky enough to get a paid internship with Kaiser back in Santa Rosa. And they ended up hiring me on, and I've been there for 20 years now. So when I started there, I did half inpatient, half outpatient. And our outpatient department used to be on the main big campus. So I would start the mornings in the hospital, work half day in the hospital, and then be in the clinic in the afternoons. And I think it's been like the last 10 years, I've just been solely in the clinic. And part of our sports medicine team, which is super fun for me because I used to dance. And so I get to work with a lot of dancers come my way, which is fun. And so, yeah, that's where I'm at.
And fun fact, that's how I know Beth, is because we danced together a few years ago. Anyway, all right. Thank you so much, Beth. So Mackenzie, if you could please introduce yourself and how your work as a counselor at the SRJC, specifically in career education, supports students with their career goals.
Hi, it's so funny, Nicole and Beth, I also dance. So we've just got a whole group of dancers here. I'm Mackenzie Galindo. I'm a career education counselor at SRJC. And what I do is I help students decide on careers that are best for them based on their own unique interests and goals and lifestyles that they have currently or that they'd hope to have in the future. So with students one-on-one, I discuss what you've done before and how that went, if it was a good experience or a bad experience. We discuss future goals, lifestyles that you'd like to have, things you want to accomplish, pathways you feel comfortable doing to get there. And we do research on various career options. We also offer career assessments. Some people are really fond of those. Some people don't, decide not to do them, but they're there to give you ideas as well if you need that. I also, as a counselor, suggest classes to take or activities that might give you more of a hands-on approach to choosing a career, because sometimes just researching and reading things, you don't always feel like you know if you're going to like it or not. So I do my best to offer ideas on how to get a more hands-on feel. And once a student has chosen a goal or maybe just a direction of where they want to go, we discuss various educational pathways. So, do you need a certificate or a degree? How long is schooling going to take you? What classes do you need? And what's going to be the pathway for you to reach the goal that you have? So we make a whole complete roadmap for everything that you would do at SRJC, as well as how to get to the next school if that's something that you're going to do. And that's most of the work that I do there. I've been at the JC for about 4 years now. And prior to that, I was at Napa Valley College and Contra Costa College as well. So I've been working with students for a long time, helping them decide their futures.
That's great. Thank you so much, Mackenzie. So this next question is for all the panelists. And so what sparked your interest in your career, and what do you love most about what you do? And Beth, if you could go ahead and get us started on that one. Thank you.
Sure. So back to the dance, I actually started college as a dance major, and there were budget cuts and they dropped the program. And I was enrolled in anatomy and a few other things because of dance. And I worked through undergraduate as an aerobics instructor and a personal trainer. So I had, an interest in sports injuries and things like that just through And so I talked to my college counselor, and I was in total limbo and didn't know what to do. And so they helped me and pointed me towards physical therapy. And so, I needed some help, because when I first went into college, I was in theater and dance, and I didn't have a heavy science background in high school. So I definitely had to get help to get all that, because there's a lot of prerequisites with chemistry and physics and such that I wasn't prepared to take on, but I did it. So anyway, that's how I ended up in physical therapy. And I think it's an amazing profession. I'll say I adore it. I love working with people. It's not a boring job. Like, even if you get the same injury, you never see the same injury twice. People are different. Every circumstance is different, and every treatment intervention is different. So it is not boring, and you get to meet a lot of people. I've met a lot of people that have become family and friends, and it's fun to help people. So that's what I love about it the most.
Well, that's great. Thank you. Bree, how about you? What sparked your interest, and what do you love about what you do?
So I've always been interested in kind of, how the body works, how, the inner workings of the body and the mind. And so I also just really enjoy and love people and building relationships with people. I love to talk. I love to be social. And I also really like helping people in general. So for me, I never really thought that nursing would be where I ended up, to be honest with you. But once I got kind of, exposed to, the field of medicine and nursing, it makes sense that I chose this career pathway. I kind of came about it kind of, I guess, unconventionally. It wasn't like I got out of high school and I knew, I was going to go on this track. But luckily this is, I got some exposure doing phlebotomy, and that really, I wanted to go back to school, actually, to go to PA school. And I happened to just kind of apply to the JC nursing program, kind of as like a backup plan, in case I couldn't get into the school that I wanted to. And then I got in, and so I went, and here I am. And it really, I love being a nurse. There's so many different opportunities for learning within the nursing role. There's a lot of different jobs and subspecialties and specialties that you can go down the road with in nursing. And so there's always opportunities for learning and growth and development. And you can do one thing for, 5 years, 10 years, 12 years, and then completely switch it up and do something completely different with your nursing degree. So that's what I love. And I get to meet people. I get to help people. And I get to, it's a very empowering role to be in, because you can really affect change for your patients. And to me, that is probably the best part about nursing.
Oh, love that. Thank you. So next, Mary Kay, what sparked your interest in your career, and what do you love most about what you do?
Yeah, and Bree, great examples of what being a nurse is all about. Hard to top that. So my path started a little sad. So when I was in 9th grade, my father had a stroke, and he ended up passing away at the hospital. And so we spent a lot of time on the unit, and the people that I talked to and spent the most time with were the nurses, and just being very supportive, very caring for my dad, giving emotional support to a teenager. It just really made me think that this is a career that I want to do, that I want to help people. I want to be there for them at their most difficult time and be a support for the patient and the family. I tend to be a pretty optimistic person and a pretty friendly person, and I think when patients and families are going through really hard times, it's good to have that comfort and to have somebody that's there supporting them. So that's how I got started in nursing. And as Bree said, like, I've been a nurse for 30 years. So, just having the opportunity to do so many different things and change up, whether it's the populations you care for, I did neurosurgery for a while, and then I switched to burn trauma, and then I went to administration, and now I'm doing quality and risk. But you also can travel. I mean, so for young people, you have the ability, you can travel throughout the United States, and you can actually travel internationally as a nurse as well too. You have nurses that lead hospitals that go to get their doctorate and are the CEOs of hospitals and corporations and sitting on governmental boards and things like that. So the nursing profession is awesome. And if you're somebody that likes to change things up, this is a great profession because you literally can just take care of patients, which is awesome to do your whole career. Or you could go to, developing health policies, developing clinical technology that nurses will use. There's just so much you can do. And that's, why I'm proud to be a nurse and promote the profession. And, it's been a tough time for nurses during the pandemic. And I think a lot of people have realized what an important role all of us, PT, everybody that's caring for patients during this really taxing time. It just shows how resilient and how strong the healthcare profession is. So, kudos to all of you as well.
Thank you. Yeah, definitely. Mackenzie, the SRJC has quite a few health science programs. What are some of the popular programs, and on average, how long does it take to complete these programs?
So we have a ton of health science programs at the college. I would say they all are popular. There are some ones that come to my mind immediately, especially because of who we have on the panel today, but nursing is an incredibly popular program at SRJC. And that program takes about 2 years once you're in the program. However, all of our programs or the majority of our programs for health sciences have prerequisites that you have to do before you can actually start the program. So let's say you were to graduate high school and come straight to the JC, you couldn't start the nursing program, but you could start all of the prerequisites. It takes about 2 to 3 years to get through those prerequisites. Some people can get through them more quickly, but that's the average time frame. So I like to really be realistic about the rigor of the classes and that they can take that long. So to do the full nursing path at our school, and most schools, it's going to be 4 to 5 years typically to get through the whole thing. Once you do your prerequisites, which take 2 to 3 years, you apply for the program. It's a lottery, which means that you may or may not be accepted, even if you are the perfect student. You're placed essentially into a hat and then selected at random, as long as you meet the cut score requirements. I won't go too much into that, but just keep in mind that your GPA at the college matters. High school grades are not looked at, though the preparation is important, of course. So that's nursing. So nursing is very popular. We get a lot of applicants from all over who apply to that. In addition, we also have dental hygiene, also very popular, same time frame, same, very similar prerequisites, actually, similar classes you have to take. Same thing, the GPA matters, and it's also a lottery. So that's if you wanted to be a dental hygienist. Another very popular program is our RAD Tech program, radiology technician. So that one's also 2 years, but it only takes about 1 to 2 years to get through the prerequisites. So the prerequisites are a little bit different than nursing and dental hygiene. And for our program at SRJC, it does not take quite as long to get through those prerequisites and apply. The GPA at the JC also is not factored at all. It's just completing with a C or higher all of the prerequisites. A lot of people do choose to do that program. Those are all degrees and very popular, and all 2 years. We also have shorter programs that are a great way to get started and get into the medical field, especially if you're not quite sure what you want to do yet, or you want something faster. You could do medical assisting, and our medical assisting is both clinical and administrative, so that you can do both sides, which is, to my understanding, what is being hired right now, is medical assistants that do both clinical care and administrative work. That program is only 1 year. And it also requires 1 to 2 semesters of prerequisites. So 2 years at most to get through the entire medical assisting program, versus, 4 to 5 years for nursing, for instance. Dental assisting is another shorter program that we have. It's only a year long, just like medical assisting, but there's no prerequisites. There's no prerequisites. You do still have to apply, but there's no prerequisites, so it's only a year. We have a bunch of other programs. One I want to mention is the CNA, Certified Nursing Assistant program. That's only one semester. It's only 10 weeks long and there's no prerequisites. It's one class. And so if you wanted to start as a certified nursing assistant to get some experience, work on call, maybe while you're in college, working towards a different health program, that can be really useful. Some nursing programs, not ours, but other nursing programs require that you're a CNA first. So that can sometimes be a good thing to start with. And finally, we have some dietetic programs. I'm not going to go into those ones today, but keep in mind, we do have some of those too. And the last thing I want to say, Nicole, is just that we do help students prepare for things that are not at the JC as well. We have a great amount of programs, but if you wanted to be a respiratory therapist or psychiatric technician or an occupational therapy assistant or physical therapy assistant, or if you wanted to do physical therapy itself or any program that's not at our school, you can prepare at the JC. You can do all of your prerequisites for any health program at the JC and then apply to the school that you want to go to. So if you wanted to stay closer to home for a little while, it's absolutely okay to do so.
Great, thank you so much. Very informative. This next question is for all the panelists. So what skills do you rely on in your current work, and when and how did you start to develop those skills? And Bree, if you don't mind getting us started on that.
So when I was thinking about this question, I was thinking about, kind of two categories. So there's the skills that you learn in school and on the job. And then there's skills that you have that you come to the profession with. And so I think it's really important to kind of identify what your natural affinities are, what your natural what you just kind of are drawn to begin with. So for me in that category, and those can be learned as well. Not that they have to be, built in you from the beginning. They can be learned and, developed. So for me, I think interpersonal skills are huge in the nursing role. Communication is something that basically everything else flows from. So being able to communicate effectively, not only with the doctors and, different subspecialties within the nursing profession and within, medicine in general, but also with your patients. You really have to be able to develop trust with your patients. And so being able to communicate effectively and not just being able to say things, but also being able to really listen to people. And being able to kind of intuit what it is that they're trying to communicate, being able to kind of ask questions of people and draw certain things out of them. But trust, I think for me, developing trust with my patient is the first primary, order of business. Obviously in the nursing role, you have to have a lot of compassion and empathy because you're taking care of people, when they're at their worst. So being able to really see your patients and be compassionate for them and understand that they're not really themselves. Also being able to multitask, having good time management, being disciplined. As a nurse, you're always juggling, a multitude of things. You don't just have one patient, and those patients don't just have one need. So being able to manage your time, being able to prioritize tasks and situations is something that I have to do every day in my profession. Also, what falls under that side is being confident, being able to, being just really believing in yourself and being able to speak what it is that you're trying to communicate, and knowing, being able to ask questions of your superiors and your leaders as well is really, really important, especially as a new nurse. And then on the, the more clinical side, you have your clinical skills, your hands-on skills, the things that you learn in nursing school, the things that you learn on the job. So for those categories, it would be, your assessment skills as a nurse are really important. Being able to do a physical assessment and know what is normal and what's not normal. And then obviously computer literacy is huge. Everything we do is, through the electronic health medical record system. So being able to, be proficient and computer literate is a must. What else? Being able to, the hands-on skills, also reading and writing and math are all incredibly important. As a nurse, you're passing medications all of the time, and safety is huge. So being able to have really, really good reading and math and writing skills, because so much of what we're doing, your orders are coming through in that format. Being able to recognize when something might not be right, and then being able to ask questions and get clarification. And then the other thing for me is, patient advocacy. So that's my role as a nurse, is constantly advocating for the patient. So those are the skills that I rely on all the time.
Great, thank you. Yeah, it's a lot. Yeah, thank you for that. So Mary Kay, how about for you?
Great list, Bree. Totally agree with all of those skills. So I'll add a little different perspective, and I think everybody in healthcare can appreciate this, is that, it's been a tense time. People are frustrated, they can be angry, they can be, scared. And so some of the skills that I find that are really important these days is, the first is to have emotional intelligence, so that you know what your personal triggers are, how you communicate best, how you communicate, what are your gaps and where can you improve, because that's going to help you respond to these situations that can be tense. And then some of the other skills that I have been using recently is, being able to de-escalate situations. People can get really upset, whether if they've waited too long, they don't feel like they're getting an answer, they, couldn't find a place to park. There could be a lot of things with just the stress of everything going on in the world. Healthcare just can, sometimes put people over the edge. So being able to de-escalate, and then, being able to make decisions. You have to decide, what's the highest risk, what's the best for the patient, what's the best for the staff. And then there also is negotiation and conflict resolution we have to do too, right? We can't always give everybody every single thing that they want. And so there's times where we have to, come up with a win-win for both sides. And you have to be able to have those skill sets to be able to have those conversations. So those are some things that I definitely have been, using more over the past few years.
Awesome. Thank you. Thank you. And Beth, how about for you?
Both Bree and Mary Kay said it perfectly, and it's pretty much my list. So, but yeah, definitely, I think compassion is on the forefront, and and then that kind of builds on everything in terms of, like Bree was saying, not just being able to communicate what you need to say, but being a really good listener. And I'd say through the pandemic, like that's been one of the biggest things, is much less about my clinical skills and expertise, and much more about being able to listen, and empathize and try to help and motivate, and so definitely I think those communication, interpersonal skills are very important. And you need them all the time. So, and I also agree with what Bree said, is like, some of those are, kind of innate in your human, personality, and you bring those to the table, and then you learn the other stuff in school. It can also be learned, specifically in physical therapy, I think, and I mean for nursing as well, but just critical thinking is super important. There is not a cookbook, right? So you can't have somebody come in and be like, oh, this is Achilles tendonitis, I know exactly what to do for that injury, when it could actually be, it could be nerve pain coming from their back. You have to decide, figure it out. Is this muscle? Is this bone? Is this tendon? Is it nerve? Is it, you can't just point and go, it hurts here. Oh, look at my anatomy book. That's the structure, right? It could be referred from another area. It could be an organ doing it, so you have to be able to say, is this a musculoskeletal injury, or is this kind of a red flag that we're dealing with something else and you need to go back to your doctor now? So being able to think outside the box. And, even in exercise prescription, you can get somebody that can do really high level exercise, and you have somebody that needs to go like 3 levels down, or, you want to give them something, but they also broke their wrist and they can't touch that. Or like in the hospital, you have somebody that's in a car accident and they can't put any weight on this leg and they can only toe touch on this, and trying to figure out, how am I get this person up, and what assistive device can they use? Can they even put weight on that hand? I get, that critical thinking piece. There's not a cookbook. It's like you're always kind of on your toes. Yeah.
Definitely. Yeah. So definitely those soft skills, or those essential skills, really paired with those technical skills that you learn in the programs and in the job, right? Thank you. And then Mackenzie, what skills are necessary for students pursuing programs in the health science careers that like highlighted here today?
Yeah, so it's just interesting listening. I think as a career counselor, I'm thinking, wow, a lot of these skills are actually needed in so many workplaces. So as a reminder to any student who is unsure of what they want to do right now, these are all amazing things that you could do for so many different careers. Problem solving and critical thinking, communication skills, people skills, compassion. These are all critical in so many different jobs. But I also want to encourage you, if you're not so great at like conflict resolution and things like that right now, some of it comes with school and some of it just comes with practice and experience. So if anyone's feeling like, whoa, I can't do any of that yet, it all comes over time. Most people in high school don't love talking out loud, or, in meetings or to other people. They like to just talk to friends, but those skills do come with time and practice. So if you were to pursue a health program, particularly the ones mentioned today, there's some things in school that can really help you get through those classes. And one of the ones is problem solving and critical thinking. So if you were to focus on any skill right now, that's one of the main ones I would consider. Is anytime you're faced with a problem, think, okay, what can I do to solve this? What resources do I have? What experiences have I had in the past? What's some research I could do online, right? So really thinking, okay, I do have this difficulty, this problem, now what? Right? So not ever getting too stopped up by something, right? Just knowing that there's going to be a way through. Utilizing your resources, SRJC specifically, but also so many other places have resources for you to help you succeed in these classes. You're not meant to do everything alone, right? It really does take a village. We have resources for a reason, and it's because school life, getting a career, it's all hard, right? We need to utilize each other. Communication skills are really important even for your classes, particularly in asking questions and listening. Right? So listening critically, taking notes, and then asking questions, and not being afraid to say, I don't understand that. Can we try it a different way? And advocating for yourself, right? Study skills and time management are important. If you can practice those now, that's awesome. You'll get better at them, and you can utilize different tools online, counselors, or you can even take some classes on study skills and time management right away in college, or even before you get to college. And that can really help set you up for success. That's really important. Lastly, I don't want to go throughout all the skills. You need lots of skills, right? But lastly, the last thing I want to mention is patience. A lot of these programs are long and hard. So having patience and remembering why you're motivated to do this. Why is this important for you, for your family, for your future, for what is meaningful to you about it, what giving you purpose, right? Serving the world. What is that deeper why for you, and really sticking to that as things get hard and difficult, and just having that perseverance.
Definitely. Thank you. Yeah, that's great. Great information from all of you. So we are going to actually go to the Q&A. So Kim Handel will unmute and ask the questions from our attendees. We have lots of questions. We probably won't get to all of them, but go for it, Kim.
Wow, we have so many good questions. Shout out to Eric, because he has a bunch of them in here that I'm like, ooh, that's a good one. It's hard to choose just a few. But so one question that we had and was about dual enrollment classes that you might recommend. So a lot of our students take classes at the JC or other colleges as high school students. So this one may be like for Mackenzie, if there's any kind of like introductory classes related to the medical field that you think would be good for high school students. And then other panelists, if you have any thoughts about classes that might be good for a high school student to take.
Absolutely. I'm so glad of this question. Okay, so I mentioned that there are some study skills and time management classes. Those would be fantastic to take now. You cannot overestimate having the time management and the study skills to help you with your science classes. Okay, so Counseling 53 and Counseling 60. Counseling 53 is a 3-unit class. So it's like a regular college class, and it's all about the things I just mentioned. Counseling 60 is like a mini version of that. So it's less units, a little less time involved. So those are two good options, Counseling 53 and Counseling 60. You can also take like kinesiology. I want to say it's 53, but you can look at our lecture kinesiology classes. If you're interested in majoring in kinesiology to then become a physical therapist, right? Or an occupational therapist, finding out if you like kinesiology first would be a great first step, right? Again, that deeper why. Let's make sure you like it. Okay. Science intros, Bio 100 and Chem 100. Bio and chemistry are critical for all of these programs. So if you're feeling a little rocky or want a little extra practice, Bio 100 or Chem 100. These are really intro classes. Okay. So if you're like, I already got that, well, then we can go up a level instead. And lastly, great English skills, great math skills. So you might want to work with your counselor to decide what level am I at? And, should I be doing a college level class? Or should I be doing just my high school classes, honors, AP, etc. Those are some things I can think of offhand, but you're always welcome to contact me too, and we'll talk about something that's perfect for you.
Awesome. Those are some good suggestions. Any of the other panelists, do you guys have any, I don't know if you took college classes as a high school student or just any thoughts about classes that might be good for high school students?
I was just kind of going to echo what Mackenzie said, which is, if you, once you kind of are able to assess where you are in terms of, level, if you are able to take a college level class, like an English or a math class, and start chipping away at some of those prerequisites, it will buy you some time in the future and kind of shorten, the amount of time that you have to be doing some of that undergrad work. But again, those are, hefty kind of chunky classes for, 4 and 5 unit classes. So if you think that's right for you, I would say sit down with a counselor and see if you can do that. Also, the JC has great, really kind of immersion classes during the summertime. They're a shortened amount of time, but you're there a lot more on campus. They're like 3 days a week or 4 days a week. So you can really have the opportunity to chip away at some of those prereqs, but in an environment where you're going to get a lot of learning done in a short amount of time.
Yeah. And actually I just want to jump in. So we did have someone who asked, this would be a question for Mackenzie, but they asked if the JC is going to be offering the Summer Career Health Institute this summer. So I don't know if you have an answer for that. And if you could kind of explain what it is.
Nicole, I don't know if you already know the answer to this, because I actually don't know at this time.
I think it's going to be another year out. Unfortunately, I think another year out just because of everything going on.
And you might actually even be more familiar with this program than me, just because it's more on the high school side. Did you want to explain what it is?
Yeah, I mean, I think that they're revamping the program. And but in the past, I think my understanding is that they just gave them a very kind of overall view of health science program. So it's kind of a little bit of, like trying a little bit of everything. But it's been a few years since a student's been in it. A lot's happened the last couple of years. So not 100% sure of all the details, but I do know several students who went through the program and found it very useful. I think it's a really good program for students who just want to try on, like, how do I fit, how do I fit, or how does health science fit for me, right? And what maybe particular area in health science would I be interested in? So that's my understanding, but don't quote me on that, even though I'm being recorded.
So maybe it's something for younger students to look for in the future. If hopefully it'll be offered again soon. Mm-hmm. There was a student who asked about ideas for trying to find an internship. And so I guess, and so maybe if you have any ideas about internships or other kinds of activities, like community service or anything that would be, would provide good experience for students interested in a healthcare career. And this could be for, I think, any panelist who has ideas.
So at Kaiser, we definitely have a lot of different volunteer opportunities. They do a student internship program in the summer. They still do some shadowing as well. So I think, working through community relations in school to do that, I think it's great to just get exposure to the different types of healthcare settings and things like that. But there definitely are volunteer opportunities.
Great.
Mary Kay, is the summer program, is that the KP Launch program? Is that the one you're referring to?
Yes. Yep.
Yep. I think that information's been going out to the high schools. So look out for that, students who are interested.
Any other thoughts about, just like programs or community service or jobs or anything that would be good experience for students?
I don't know if they still do it. But Sonoma State used to offer the Excel program during the summertime. And they definitely had like a health sciences kind of portion of that. And I attended that when I was actually in the 6th grade, and it was the most amazing program. I remember they were letting us like dissect little pigs and do all kinds of different things, which was really cool. And it definitely got me turned on to nursing and medicine. So yeah, if that's still around, I think that's a great program. I was going to also suggest, like Mary Kay said, volunteering. And I don't really know actually too much about a lot of the local programs that are going on now. But volunteering is always a way to get some exposure. People always need hands-on help and are always, interested in helping people who are willing to show up and are interested. So.
And one other thing I'll plug with volunteering for people that are shy and maybe introverted, it's a great way to kind of get out of that shell, because you have to talk to people, answer questions, respond to folks. So it's a great way to kind of build that skill set up. And another avenue is like Toastmasters, which is like a group where people get together and you practice, doing speeches and having games. And it's all about making yourself more comfortable speaking. So that's another thing that isn't in healthcare, but would help you excel, in whatever career path you go, if you're nervous about that sort of communication activity.
That is a great suggestion. One other thing I was just going to plug. So at Maria Carrillo, we had somebody, the director of the Jewish Community Free Clinic, who came, and they are very open to helping students find an opportunity that kind of suits your interests or helps you meet your goals. And so that's a chance to kind of get experience like in a smaller community clinic. So let's see. Okay, so moving on, we had another question asking if you could describe an average day at your job, which is always a fun question. And I know sometimes there's not like a typical average day, but yeah, just sort of what do most of your days look like, or what does a day look like? And this could go to any panelist.
I guess I'll start. So for me, now that I'm in endoscopy, I'm in a procedural environment. So it's a very different environment than being, a bedside acute care nurse. So I'm gonna speak to what I do now instead of what I did on a cardiac telemetry unit, which is very different. So my typical day, I start at, like 7 in the morning, and I come in, and there's a team that I work with of other nurses and doctors. And basically we look at this, I just start looking at the schedule. There's a couple different roles that I can be in at any given time in my department. There's the nursing role, which in the OR and in procedural units is described as the circulator, because you're really the one who's moving around the room. You're getting supplies. You're also doing a lot of charting and documentation for the procedure. Or I could be the tech, which is more of an assistant role to the physician directly to finish the procedure and complete the procedure. So that's also something I really like about my job, is that I have there's different roles that I can step into, different skill sets that I use. If I'm in the tech role, then I'm actually, dealing with the equipment, I'm setting up the scope, I'm entering information about the patient, I'm using different tools to obtain tissue samples or do different, diagnostic or therapeutic procedures within the procedure. So if I'm in the circulator role, I start with my schedule, I start looking at the patients and doing what we call in nursing a chart review, basically looking at the patient, reviewing why they're in the hospital, reviewing doctor's notes around why we're doing the procedure. I look at their chart, I look for their allergies, I look at their vital signs. I want to make sure I review what their medications are. I look at their labs. So basically I'm kind of assessing whether or not the patient's appropriate to come for their procedure today. And then I call the nurse who's their bedside nurse and I take report. And I basically ask them for an update because they're the nurse that knows their patient the best. And then, once I've determined that there's no showstoppers is what we call them in the OR, in the procedural environment. Like, the patient has to have a good working IV. They have to have been, nothing by mouth for a certain amount of hours. Obviously, they need to meet certain requirements for being, clinically stable. So like their vital signs have to be within a certain margin, certain medications they can't have had, all of those different types of data. And then I send for the patient comes down to me. I make sure that they've signed their consent. So I make sure that the patient understands what we're doing and the rationale for the procedure. Patient identification is huge. I have to look at their name and their date of birth and make sure that that matches, the chart and what we're doing for the day. And then really communicating with my team. So then, I bring the patient into the room. We do the procedure, we put them on the monitor, and we're all communicating and kind of doing this like dance, this whole time. And then we carry out the procedure. I'm assisting the doctor and charting and entering different information in the computer, making sure that the orders are in place. And then once the procedure is done, I have to say during the procedure, my biggest focus is safety. So I want to make sure that even though there's a physician there and there's an anesthesiologist in the room, that the procedure is safe and that the patient is safe throughout the procedure. Once the procedure is completed, then I call report to the nurse and then I send the patient back. And then that's what I'm doing kind of all day. It could be 4 patients, it could be 10 patients throughout the day. There's different types of procedures that we do. So depending on what we're doing, we might have to turn the room around if we're doing a different kind of procedure. We may need to bring in a different piece of equipment, making sure that we have everything we need. So a lot of it is coordinating care, making sure that we have everything that we need in order to provide safe patient care to the patient.
Right.
And then once that's all done, then I pretty much go home and then I do it all the next day.
You are doing a lot, have a lot of stuff going on. I'm
yes,
sure.
but it, you learn and you get into a rhythm and into a groove, and getting to be a part of a team is really fun too. Because,
Yeah.
It's
right.
a different kind of environment being in the procedural place.
Great. Well, thank you for sharing that. I wish we are kind of running out of time. I wish we had more time so we could hear.
I'm sorry, that was a long video.
No, you're good. That was probably like a really difficult question to answer, because there's so much that you guys all do. So thank you for sharing that. So we probably need to wrap it up, but I just wanted to let everybody know that I put the link to the CareerFest website. So for anyone who's listening, if you want to check out the recordings of all of our sessions, they will be available within 24 to 48 hours after the session ends. And so there's all of our sessions have been, I think, really good information. And I would encourage you guys all to check them out. And I just want to thank all of our panelists and the students and teachers who attended. And Nicole, do you have anything to add?
Yeah, no, thank you all, the panelists, for being here and speaking today. Very appreciative of your time in the middle of the day. And thank you again, to all the attendees who are here and all the thoughtful questions. We really appreciate it. And I wish we could have gone to all the questions and heard all the answers, but we want to be respectful of everybody's time. So I hope you all have a wonderful rest of your day.